welcome. I'm so glad to see you here at Menopause University. This is where you learn everything you need to know in order to manage your menopause your way for the rest of your life successfully. This is video number 282. It's part of a unit in which we are looking at the 3 big diseases that are due to estrogen deficiency. And my goal in this unit is to point out some of the similarities and differences between these 3 diseases. I've already given you a huge unit on each one individually. Videos 160 to 185 were on heart attack. Videos 196 to 231 were on osteoporosis. And videos 236 to 280 were on Alzheimer's. In this and the 2 videos following it, I will compare just 2 of the 3. And today we're comparing heart attack and osteoporosis. And as we progress through this and the next 2 videos, you're going to discover all sorts of interesting things. In my book, in both the first and the second edition, Chapter 28 is the heart attack unit, and Chapter 29 is the osteoporosis unit. You will find the information in those chapters as it pertains to the particular disease. You will not find it in a comparative way like I'm going to be giving you here. This is why it's so good to watch the videos in addition to reading my book. You get such a good education that way. So, did you ever think you'd be comparing 2 diseases as different as heart attack and osteoporosis? I mean, your heart is a muscle that pumps blood all over your body, while your bones are part of your body's scaffolding. Are you thinking, how could they possibly have anything in common? Well, if you are, I understand. But my mind works in strange ways, and I can think of all sorts of things that they have in common, as well as all sorts of things they don't. For purposes of consistency, we'll use the same format in this video that we used in the last video, which compared all 3 of the big diseases of estrogen deficiency. And we'll continue to use that format for the 2 videos that follow this one. In essence, we'll use this list of factors as a guide, modifying as necessary. Cause, risk factors, incidence, pathology, symptoms, diagnosis, management options, prognosis, and mortality. But rather than focusing on making a chart, I'll expound on various details that make you think about these 2 diseases. So let's start with the causes of heart attack and osteoporosis. As you know, all 3 diseases of estrogen deficiency are really due to aging. It just so happens that estrogen is what prevents aging until you lose it at the time of postmenopause. So the cause of the aging process in both your heart and your bones is the same: estrogen loss. You don't typically have either of these problems before you lose your estrogen. They begin when your estrogen ends. Estrogen deficiency meets every criteria for causative agent for both heart attack and osteoporosis. And this makes perfect sense if you acknowledge the fact that estrogen was your fountain of youth. That's precisely why women associate postmenopause with aging. It's also why many people are in complete denial about menopause. You see the rapid aging that occurs on the outside of your body when you lose your estrogen. And both heart attack and osteoporosis are manifestations of the aging process that takes place on the inside. Now, what about risk factors? I gave you a video entitled How to Know If You're at Risk for a Heart Attack in the heart attack unit, and it was video number 167. You'll recall this chart of all the risk factors for a heart attack. And I did the same for osteoporosis. That was video 203. Here's a chart of the risk factors for osteoporosis. Take note of the risk factors that were common to both diseases. They are sedentary lifestyle, smoking, diabetes, family history of the disease, and personal history of the disease. What's more interesting is how different most of the risk factors are for these two diseases. Obesity increases your risk of heart attack, while being too thin increases your risk of osteoporosis. Lots of exercise decreases your risk for a heart attack, while it increases your risk of osteoporosis. What you'll realize is that there are some risk factors that typically present as part of the whole picture of a certain disease. With heart attack, the typical woman at high risk is an obese, sedentary smoker who also has diabetes type 2 and high blood pressure. Obesity, inactivity, smoking, diabetes type 2, and high blood pressure are often a package deal, a bad package deal at that. But the typical woman at highest risk for osteoporosis looks quite different. She is an ultra-thin workout fanatic with a history of anorexia or bulimia. So all the things that go with trying to stay super thin are the package deal. And that's a bad package deal too. What I find really interesting is the incidence of these two diseases. They are both so common. 1 out of 3 women will have a heart attack in their postmenopausal lives, while 1 out of 4 will have osteoporosis. The problem with both of them is that no one's telling you that you're a sitting duck for them. Before learning what I've taught you here at Menopause University, you were probably more worried about getting breast cancer. You probably didn't know that a heart attack or osteoporosis were much more likely to come your way. But now that you know, you can get started on doing all the things I've taught you to avoid them. And we'll discuss those things a little later in this video. What about pathology? How do these two diseases compare with regard to the actual disease process that results in a heart attack or osteoporosis? Well, you already know that they're both due to aging. Unlike the aging of your skin, though, the aging of your heart and your bones isn't visible to you. The interesting thing is that the aging of your heart arteries consists of gain, while the aging of your bones consists of loss. In your heart arteries, you have a progressive increase in the buildup of fatty plaques. And the walls of your heart arteries go from being soft and supple to hard and brittle. And the aging of your bones, though, entails a decrease in the quantity of bone you have. You literally lose bone. So your bones go from being dense and full to sparse and hollow. I guess you could say that you gain fat and lose bone, or that you get thicker arteries and thinner bones. But then we come to symptoms. How often do you encounter a woman who says she thinks she's having symptoms that indicate an impending heart attack? Never? Oh my! And how often do you hear about a woman who had a sudden, unexpected heart attack that killed her on the spot? Pretty much all the time, right? Well, you see, that's the problem with a heart attack. Few women see it coming. Instead, despite the fact that they are abusing their bodies by eating all the wrong foods, smoking, and failing to exercise, they manage to live day after day until one day, they drop dead of a heart attack. Even though that buildup of fatty plaque and that narrowing of the arteries is gradual, you don't have any symptoms that are significant enough to give you warning. Your body just compensates for the progressive roadblock in your heart arteries until it just can't compensate any longer. And that's when you have a heart attack. But add to that the fact that the symptoms of a heart attack in a woman are not recognized as a heart attack. Women don't have the chest pain that radiates down the left arm that men have. Women have jaw, neck, or back discomfort that they do not describe as pain. Instead, they describe it as tightness, aching, pressure, squeezing, fullness, tingling, or burning. They may think it's just heartburn. And instead of pain radiating down their left arm during the heart attack, women have a whole host of mild symptoms in the month before a heart attack. These include fatigue, insomnia, shortness of breath, anxiety, indigestion, headaches, and arm discomfort. Some of those are common symptoms of post-menopause that most women just put up with. So the symptoms of a heart attack in a woman are silent until they become deadly. They do not seem consistent with a heart attack at all. Conversely, when it comes to osteoporosis, there are no symptoms, not a one. You don't feel anything. So this is why women who are health nuts often end up with osteoporosis. They are used to being very in tune with their bodies. They believe that if they feel well, all must be well. And they are shocked to discover that they've been losing bone by the bucketful with nary a sign. So osteoporosis is what we call a silent disease. You will not know you are losing bone until you sustain a fracture of your spine, hip, or wrist from something that is unworthy of causing a fracture. In essence, even though the reasons are different, both heart attack and osteoporosis will sneak up on you. Both will make their presence known when the critical catastrophic event occurs all of a sudden. So in a way, you could say they are both silent but deadly. But the ironic thing is that it's really easy to diagnose both of them. The long lists of risk factors are a great place to start. If you have more than a couple of risk factors for either disease, wake up! If you find yourself in any list of risk factors, that's a great reason to pursue the diagnostic tests for that disease. So if you are obese, sedentary, a smoker, have gum disease, or have a family history of heart attack, or if you have high blood pressure, diabetes, or depression, at the very least, get your blood drawn for your lipid levels. And if they are in line with the parameters for a high risk of heart attack, proceed with an echocardiogram, stress testing, and/or imaging studies to determine your precise level of risk. Whatever you do, at least get an accurate diagnosis. An accurate diagnosis is always the first step toward treatment. And if you find yourself in the list of risk factors for osteoporosis, get a DEXA bone density test. So if you're a thin, blonde, Caucasian woman with a history of anorexia or bulimia who experienced premature menopause and partakes of caffeine, alcohol, or tobacco, get a DEXA scan. If you've ever had any thyroid disease, diabetes, a vitamin D or calcium deficiency, or if you've ever taken steroids or any of the other medications on the risk factor list, get a DEXA scan and get it early. Do not wait for a fracture to wake you up to the fact that you're likely to fracture. And if you do discover that you're at risk for heart attack or osteoporosis, you have a bunch of things you can do to decrease your risk. Management options. Let's see. In the heart attack unit, I gave you 9 separate videos on management options alone. They spanned the gamut from dietary options to lifestyle options to vitamins, minerals, supplements, and herbs to estrogen to non-hormonal medications. And you learned that you can prevent a heart attack with diet and lifestyle measures alone. Simply eating a 100% plant-based diet decreases your risk a whole bunch. And regular exercise decreases it a whole bunch more. So preventing a heart attack is something over which you have tremendous control. With osteoporosis, though, you discovered that diet doesn't play a very big role in terms of management options. Certain kinds of exercise and avoiding falls are much more important than diet. And the calcium and vitamin D that everyone talks about so much don't really do that much to prevent it. And if they do anything, it is only for purposes of prevention when you still have normal quantities of bone. They are not suited for treatment or replacing bone loss. In the osteoporosis unit, I referred to prevention, intervention, and fixin'. And the only management options that are capable of intervention or fixin' are estrogen, some other hormonal therapies, and the SERMs. The interesting thing with comparisons of the management options for heart attack and osteoporosis is that heart attack is preventable by the simple things you can do yourself, like diet and lifestyle. But people won't do those things. And osteoporosis is not nearly as preventable by the simple things you can do yourself, like taking calcium and vitamin D. But people will do those things. So most women won't do what actually works to prevent a heart attack, but they will do what definitely does not work to prevent osteoporosis. Strange irony, isn't it? Another interesting twist is that people are quick to take statin drugs to prevent a heart attack, but they are reluctant to take medication to replace bone and prevent a fracture. And doctors hand out the statins like crazy for the slightest indication, but withhold the bone building meds until you fracture. Why? Because the guidelines are designed that way. Knowing the threshold for taking any given medication as indicated by the guidelines is extremely powerful in making sure you do what's best for you. No set of guidelines cares a fig about you personally. So, what's the prognosis for a woman who has had a heart attack or osteoporosis? Well, most women who have a heart attack die from it. 1 out of 3 have heart attacks, and 1 out of 2 die from them. But if a woman survives a heart attack, what's the prognosis? How does she fare over the rest of her life? Usually very poorly. Not only are these women in pretty unfit shape to begin with, a heart attack serves as a huge setback. And the tendency is to become fearful of engaging in exercise, even though it is precisely what will prevent another heart attack. Of course, you have to realize that exercise isn't the natural habit of most heart attack victims, nor is a heart-healthy diet. It turns out that adopting heart-healthy diet and lifestyle habits is the most difficult thing for most women. And that's one of the reasons why the statins are so popular. So most women who have one heart attack end up having another one. And there's a sharp decline in overall health after each one. With osteoporosis, it might be even worse. You see, a fracture from osteoporosis does not heal. Why not? Because there's no bone there. How can you heal a tissue that is missing the very material it needs to heal? Most women who fracture their spine or hip never gain normal function again. Most are crippled for the rest of their lives. Most are deformed for life too. They end up in nursing homes simply because they cannot function independently. Go to any nursing home anywhere in the world, and I promise you that 90% of the residents will be women who have sustained a fracture. So the prognoses after both heart attack and a fracture from osteoporosis are absolutely horrible. And that brings us to mortality, which is extremely high for both diseases. Interestingly, women are aware of the high mortality from heart attacks, even though they don't fear it as much as breast cancer, which has a much lower mortality rate. But as I said a few minutes ago, of the 1 in 3 women who has a heart attack, 1 in 2 die from it. Heart attack is the biggest killer of postmenopausal women by far. But what most women don't realize is that the mortality rate for osteoporosis is extremely high too. Of the 1 in 4 women who get osteoporosis, 1 in 5 die from it. They don't necessarily die from the osteoporosis itself, but instead from all the complications that follow. And fractures beget fractures. So one leads to another one. As you can see, there are some very interesting similarities between heart attacks and osteoporosis, but there are also some very interesting differences between them. And while the lists of risk factors do a good job at painting the picture of the kind of woman who has a heart attack versus the kind of woman who has osteoporosis, there are always exceptions. Still, I like to give you the general picture of the kind of woman who ends up with each disease. Here's a photo that does a good job of that with the typical heart attack victim on the left and the typical osteoporosis victim on the right. When you hold them up next to one another like this, you realize things that you didn't see when you considered them in isolation. Obese women can and do get osteoporosis, and thin women can and do have heart attacks. But this photo depicts the typical prototype of each. In any case, I hope you enjoyed this comparative analysis, and next week we'll do the very same thing for heart attack and Alzheimer's. Consultations are the way to put things into perspective for you personally. All the videos in the world are not as valuable to you individually as a consultation. So schedule yours at menopausetailor.me. You will feel like it is the best thing you've ever done for yourself. It's the best investment you will ever make in yourself. If all you want to do is follow me, go to Facebook, Twitter, or Instagram. And if all you want to do is subscribe, do that by clicking subscribe right here on YouTube. I will see you in a week. Bye.